50% of people stop taking their medication the first year that they receive it.
I'll just exercise and diet and get back to where I was in high school.
Is the doctor just making that up on the spot?
If your doctor's not doing that, you should probably say, hey, I want my lipids checked, right?
Yeah.
Welcome on in to the Health Elevated podcast. Failing to take your medication can be costly and even deadly. In today's episode, we're going to talk about medication adherence, and we'll focus on statins, which are drugs that help lower your cholesterol. We'll get into whether or not you need to be concerned, what the risks are if you don't take your medication, and we'll talk about all things concerning your relationship with your primary care provider. It's going to be a good one. And to talk about this, I have with me, as always, Dr. David Hedges and special guest, Doctor of Public Health, epidemiologist, Dr. Heidi May from Intermountain Healthcare. Heidi, I want to ask you, how big of a problem is it with people failing to take their statin meds or just medication in general?
Yeah, it's a big problem. Studies have shown that 50% of people stop taking their medication the first year that they receive it. And about 1 in 5 don't even fill their medication when they're prescribed it. So it's a big problem. It increases your risk of having maybe another heart attack, potentially dying. But it's a real problem to not take your medication because so many people have problems when they don't.
So when I go to the doctor and the doctor gives me a lipid panel, first off, why would a doctor want to give me a lipid panel? What does it mean? And why is that the determination for prescribing statins, for example?
Sure. So there's good cholesterol and bad cholesterol in your lipid panel. The good cholesterol is called HDL. The bad cholesterol is called LDL. So it is known that the LDL is one of the highest risk factors. If it's high, that increases your risk of atherosclerosis, which is buildup of plaque in your arteries. And when there's too much plaque, it doesn't let the blood through your arteries like it's supposed to, and eventually if it gets too narrow, you'll have a heart attack, or if one of those plaques breaks off, then it can also, and get stuck somewhere, it can cause a heart attack or a stroke. But so when there's too much LDL floating around in your blood, because your organs do need LDL, so we do need a healthy portion, but when there's too much, it starts adhering to your blood vessels, and that's what's called the buildup. And now the good cholesterol comes through your body and picks up any excess bad cholesterol. And so having a healthy balance is really important because your organs need the LDL cholesterol to function, but too much of it is not good because it can cause buildup, and then you need that good HDL to come and pick up the excess. So when you have too much LDL, there's some modifications you can make in your diet and exercise, or they might prescribe a statin medication that lowers LDL. Now, if you have a certain condition like cardiovascular disease or diabetes, it is recommended that you take a statin if you can tolerate it, no matter what.
So Heidi, really quickly, I had a quick question. So what the contributing factors to an individual developing higher, or an unfavorable cholesterol ratio? Because in genetics plays a role, but lifestyle does too.
Exactly. So the genetics, it's called familial hypocholesterolemia that you can have, and there's just a genetic disorder, and you absolutely will just need a medication to get it lower, and oftentimes you need more than one LDL lowering cholesterol medication. Other risk factors that are modifiable include physical activity. That can lower your LDL, and if you're not as active as you should be, it can raise it. Diet definitely influences your cholesterol levels. And so eating a healthy diet, not too high in fats fats, saturated fats can raise your cholesterol level as well.
So I've had the privilege, I suppose, of doing a lot of research in medication adherence, and this is a huge problem. It costs the United States billions of dollars every year because people don't take their meds. And I kind of look at statins. This is how I see it. Correct me if I'm wrong. Statins, there's not like a ton of potential side effects, at least that I know of. Maybe we can talk about that. But there's a lot of benefit because, cardiovascular problems, heart conditions are the number one killer in the United States. And if statins can significantly lower my risk of having a heart attack, for example, why wouldn't I take it? And yet we see that a lot of people fail to take it. Do you have any inclination of why something that seems to only bring mostly positive, like a very strong net positive, would be something that people just don't take?
There are some, statins can cause some muscle aches. It's very rare, and you can do a blood test to see if you're having some muscle breakdown. But I think there are some thoughts, rumors that it causes a lot of muscle aches, which studies have shown it's not as much as people might think, and it's very rare, and you can do a blood test. And I think one of the things with statin medications or cholesterol medications is you don't feel it. You take the medication, but you're not physically feeling better or worse. So sometimes when there's not a motivation of, oh, I feel worse when I don't take it, it's hard. You don't really get that physical reminder of, I need to take my medication. And, when you have a sentinel event like a heart attack or stroke, it's kind of scary, and people will take those medications, usually okay that first year. And then if you continue to not have a problem, you kind of think, is this really making a difference? So, not having that feeling of, oh, I'm feeling better, I think it doesn't remind people to take it like you might with some other medications.
One thing that I've noticed too is there seems to be almost this level of pride when it comes to statins, because as you mentioned, importantly, there are things you can do with your diet and exercise to lower your cholesterol levels, and statins kind of come into play after that. And so I've seen people before that seem to want to avoid taking statins because it's like an admission that they have failed at something, and the pride is like, well, I can take care of this myself, I'll just exercise and diet and get back to where I was in high school, and then I'll be fine. So if I got myself in it, I can get myself out. But how when is it too late where it's like, no, you got to go on statins? And because I always think of it like this too, like just because you're on statins doesn't mean you can't do the diet and exercise to hopefully get off of them. So kind of a double-sided question here, like when is it like you have to go on it, like you're kind of too late? And is it possible to get off of them once you start taking them? And how rare is that?
Yeah, so if you don't have cardiovascular disease or you don't have diabetes, your first line of recommendation from your clinician might be, let's try changing your diet and exercising. And there's kind of a clinical feel from the physician at what time do we just give them that opportunity to change it through diet and exercise, or should we stop the statin? There is an age component where they might feel, if you're less than 50, let's start without that diet and exercise. But if you're 65 or older, there just might be a little bit of weighing back and forth with the clinician. But if you don't have diabetes, cardiovascular disease, a lot of times they'll say, let's start with diet and exercise. And if you are able to lower them, that's fantastic. And you just need to keep on that habit, and your clinician should continue to monitor that. If you get on it and able to really pick up those good habits of a good diet and exercise and lower it, you maybe could come off of it. if you don't have cardiovascular and diabetes. But if you have those diseases, then you should be on it indefinitely and continue to take them.
So Heidi, when your physician's working with you, so say I go in, doctor says, okay, I guess really like you need to get some statins in, or let's work with you on like improving your diet, cleaning up your diet, getting some better exercise. Is the doctor just making that up on the spot, just kind of like how you present, or is there a host of research that the doctor is implementing when working through that? So they're trying to match personas or not personalities, but kind of I guess group you with similar people who've done well in the past, or are they just thinking, today I'm just going to recommend diet and exercise, tomorrow I'll recommend statins? Like, what's going into that decision?
Yeah. Well, hopefully you go and do your wellness checks every year, and your physician would get a sense of your personality, how you've evolved over the years. And I think that they take that into account, watching some of your habits and how things have changed. Has there been something in your life, a life event that's maybe caused some increased stress that's contributed to an unhealthy diet and lack of exercise? So having a relationship with a clinician is really important, because they can gauge, what's the best solution for you. And so I hope there's a personalized approach. I think that's always important, because when there's usually education involved, and they're educating the patient, like, this is where a good level is. This is what you do to decrease it. What's going on in your life? How can we work on this? So I hope there's a personalized approach with the physician, and it's just not one size fits all, because everyone is different and they need to be treated for what's best for them and what's going on in their life. But there are certainly recommendations that they need to follow, and guidelines that they should follow, and then taking those into account with knowing the patient is really important.
So a lot of what you said has to do with education. I think there's probably too many people walking around with high cholesterol that have no idea that they have high cholesterol. In fact, I saw this in a friend of mine who had high levels of cholesterol, and he had no idea. And then finally he got it checked, and it's like, how long has he been walking around with that high cholesterol,
Yeah.
Is that a real concern, the amount of people that just don't know because it's not checked? Because this is usually, a lipid panel is covered in your insurance, every year when you have
part of your wellness check. Yeah,
exactly, part of your wellness check. So why would people not get it? Is it the person's choice? Is it the doctor's choice? Or am I just wrong about that? Or do people know? And my friend was just an anomaly.
Yeah, I think it starts with even going to your wellness checks. I think that's something that's lacking among individuals. People aren't very good about going unless they feel sick or have some other condition. So starting out, let's do those wellness checks every year. They're covered by your insurance, and they're really important to monitor cholesterol, blood pressure, all those risk factors for cardiovascular disease. And when you go in for those wellness checks, the clinician should be ordering a lipid panel. They are covered by insurance, like you mentioned, and it's quick and easy. And so it's really important that the clinician does that. And if for some reason they forget, it's okay for the patient to remind them.
Yeah.
And, and I think they do, it's great now. There's those patient portals that you can log on and see your results. But I think a lot of times now they're sending out messages. I've gotten things in the mail, or a message through email. So the communication is becoming a lot easier for patients to find out what their levels are.
And one thing we always try and bring up on this podcast is helping individuals kind of take control and ownership of their health.
Yeah.
And maybe one of the concerns is, and we've touched on both of these now. On the one hand, you're not taking your meds because you don't feel any different, and that's a lack of education on your part for what it's doing inside of you and what it's actually preventing for you, as far as cardiovascular or strokes or events or strokes are concerned in the future. But there's also a responsibility, I think, that if your doctor's not doing that, you should probably say, hey, I want my lipids checked, right?
Yeah. Yep. Yep, absolutely. And there's so much out there now. And a lot of when I go to the doctors, and if you're say, well, you have this condition or that condition, there are some standard handouts that the clinicians can hand out. Super easy. I hope you read them because they're very informative. But you can do your own research too. There's some websites that the American Heart Association has, CardioSmart, that shows mechanisms and how it, how the LDL travels through your system and how it causes buildup. There's something about visualization now where if you can see it, it's more of a reality. So going in and using some of those resources to educate. I know some of the clinicians I work with, they love visual aids, and they'll pull out those little movies and handouts and sit there and educate the patient. See, this is what happens. This is why you need to take this medication, because the plaque is building up like this, and it's really important. And we're doing a study that does CAC scans, and you can look at plaque buildup, and the clinicians I work with love to show the results of those, because these are your arteries, and this is how much plaque it is in there, and this is how they're narrowing. So using some of those resources, whether you look them up yourself or if you're a clinician and you utilize them to educate your patients, there's some fantastic resources out there.
Can it go too far? Well, maybe not too far, because so we need, at least I rely on physicians to try and interpret these panels for me, because I think the idea of good and bad cholesterol is easy to understand, but might be a little simplistic. And I think the interpretations require more nuance, like where are the triglycerides at? What is the ratios and all that? I have heard people, and this is what I'm getting into with maybe it goes too far. I have heard of people who suggest that you shouldn't be too concerned about your lipid panel, kind of take the control so much into your own hands that you don't trust what your doctor tells you. For example, I've heard it said that if you're on the ketogenic diet, which for people who don't know is a very low carb, high fat, high protein diet. And so there's a lot of fat consumption generally in this diet. And as you mentioned before, higher saturated fats could potentially lead to higher LDL levels, for example. So I've heard people say that, hey, if you're on the ketogenic diet and your doctor's like, hey, here's your lipid panel. Oh, your LDLs are high, and let's maybe consider putting you on a statin, for example, that you shouldn't actually trust that, because you know that you're taking a ketogenic diet and that can artificially inflate your lab results. Is there truth to that? If someone's taking a specific diet like ketogenic, that it can change those lab results? And what's the relationship there with the doctor when it comes to trust?
Yeah. So this is when it's really important that you communicate with your physician and tell them, hey, I'm doing this ketogenic diet. I've been doing it for this long. There's some studies that have shown that ketogenic diet can be really good in the short term. There's been no studies that have looked at it long term. Some of the benefits early on are lose weight, lower blood sugar. One of the risks is, since it is high in fat, is an increase in your LDL cholesterol, because it is a fat dominant diet. And studies have shown that there might be an initial spike in LDL, which may taper off over a month or two back to normal levels. So if you go in and you had initially started that ketogenic diet and your LDL is really high, you need to communicate with your physician and say, hey, I just started this, and you might recommend, well, look at your fat. What proportion are you saturated fat, good fat, bad fat? Let's try to lower that saturated fat intake and take more good fats, and then come back in a month or two, typically 6 to 8 weeks. I'd have you come back and retest that LDL. If it hasn't gone down, it's not trending down quite a bit, then you might want to start on a statin. But it's really important to communicate with your clinician and just think this is what it is, because you want to monitor what's going on in your body. And it might just be that the ketogenic diet has caused an increase, but it will taper off over the next few months. Maybe it won't. Maybe you had high cholesterol before you started the ketogenic diet, you just didn't. So communicating with your clinician is so important, so they know how to best test and treat so that you can stay healthy.
Yeah, knowledge is power when it comes to these medications.
Right.
Yeah.
Exactly right.
And with that, it is time for 1 minute for 1%.
So we've been talking about medication adherence, lowering that LDL cholesterol, especially with statins. We discussed one of the things with, your cholesterol, you don't necessarily feel better when you take the medication right off you. It's a prevention of future events or anything cardiovascular related, things like that. But we need to remember to take those. They're very important to lowering your risk. So one way you can improve your health is take your medication, but we often need help doing that. So I highly recommend getting a pill bottle. And you can fill this pill box up at the beginning of the week, put the medications that you need, put the box where you'll see it. Like if you take it in the morning, put it by, your toothbrush, or at night by your toothbrush, wherever you take it. They're very inexpensive. You can get them on Amazon for $3 to $7, or you can pick them up at your grocery store, your pharmacy. But I highly recommend doing that. It creates a habit and something that in the long run will really keep you healthy by taking your medicine. And it's a really easy thing to do, and it will improve your health by hopefully more than 1%, but definitely by 1%.
And something as simple as a pill box, and I like what you said too, putting it somewhere that you won't forget, like where you already have a habit established next to the toothbrush, for example.
Yeah.
Can be huge, because this is very important. Everything that we've been talking about, I'm going to get a pill box because taking your medications, even if that's your vitamins and supplements that you're taking, is a big deal for your longevity and your health. Thank you for listening to this episode of the Health Elevated podcast. If you liked what you heard, please consider sharing it with your family and friends, or giving us a like or review. If you have any topics that you're interested in having us discuss, or you potentially want to be a guest on the program, please email us at healthelevatedpodcast@selecthealth.org. That's healthelevatedpodcast@selecthealth.org. Otherwise, we'll catch you in the next episode.